Good evening. My name is Mike Cavanaugh. This is another edition of Cavanaugh's Corner, the labor talk show here in southern Maine on public access television. This evening we're going to be talking about the healthcare reform debate, and in particular the single-payer alternative, which has been given altogether too little attention in the media and the public debate. I'm joined this evening for our show, first of all, by Dr. Cliff Rosen. Cliff is the Chief of Medicine at St. Joseph's Hospital in Bangor, Maine, and he is also a founding member of Physicians for National Health Program, the Maine chapter thereof. And Cliff, welcome.
Thank you.
Glad you could join us.
Thank you.
I'm also joined on the speakerphone by Sara Nichols. This is a first for Cavanaugh's Corner. We are using the technology and patching in live Sara Nichols from Public Citizen in Washington, D.C. And Sara, please forgive me if I don't get this exactly correct, but Sara is the chief of the single-payer effort that Public Citizen is launching in Washington, D.C., and has worked on the single-payer campaign both nationally and particularly in the effort in California, which we'll be talking about a little bit later. So Sara, can you hear us?
Yes, thank you.
Okay, well, welcome to our show.
Thanks for having me.
All right. Let me just start quickly for our viewers by asking Cliff and Sara if you could both just comment a little bit to people as to what is it we're talking about when we discuss a single-payer alternative to our healthcare system.
Well, I think to make it relative to the state of Maine, it would be one government, for example, the state of Maine, or for the United States, the federal government providing the reimbursement for people who are getting health care. Or another way to look at it is that there'd be one person that would be paying the bills, or one organization that would be paying the bills for all of a person's health care. So in this case, the payor being the government, whether it be state or federal. And so instead of dealing with insurance companies, of which there's 1,500, you'd be dealing primarily with the single institution being the government.
Okay. Sara, you want to add to that or amplify that in any way?
Well, just to tell people that the beauty of the single-payer healthcare plan is that it can provide you with full benefits, major medical plus mental health plus long-term care plus some dental, all for the same expense that we are paying now as a nation to cover only a portion of the population, and it can cover every single person in the country for that same amount and provide us full security. And the reason, as Cliff just amplified, is because it eliminates that wasteful layer of insurance bureaucracy and replaces it with a much more efficient single payer, one payer of all those claims.
Okay, now the fact is that as we're taping this show on the 10th of August, 1994, healthcare reform has been talked about for years in this country, and literally as we're talking today, the Senate is debating healthcare reform. They are debating a proposal that our Senator Mitchell here of Maine has introduced. Single payer is not one of the options that's being debated, however, today. And I wonder if you could both just offer your opinion as to why is it that healthcare reform has been defined so narrowly as to not encompass single payer as even on the radar screen?
Well, I think I could start by saying that I think it's more accurate to say that what they're debating is insurance reform and ways in which to get the insurance companies to conform to certain rules and regulations. But it does nothing about cost containment. It really does very little about providing simplicity or access. And even with the most globally debated bill, such as the Gephardt bill, we're still talking about private insurance companies, a number of different scenarios that don't get at the single basic issue as what is the simplest, most cost-effective way to deliver health care. So I would say that we're talking more about insurance reform rather than healthcare reform, and that insurance reform is already going on de facto, despite the fact that they're still discussing it in Washington. There are mega mergers between insurance companies and new ways that they're proposing to do things, but without getting at the basic issue of trying to insure everybody, trying to improve or make access universal. And the key point, as Sara pointed out earlier, was simplifying the process so that we reduce administrative costs.
Mm-hmm. Sarah, you're down there in Washington, D.C. Is anybody down there talking about single payer other than you?
Yes, but most of the conversations are going on in the House. In the House of Representatives, as soon as the Senate acts or doesn't act, depending on what happens, the House will vote not only on the Gephardt bill, which is the House leadership proposal, but on the single-payer bill, which, as many people do not know, is the only other bill that passed out of committee besides the Clinton versions of the Clinton bill. And that bill will be voted on the House floor and is actually presently expected to garner well over 100 votes, possibly as many votes as Gephardt himself is currently counting for his own bill, meaning that the Gephardt bill is in bad shape, but the single-payer bill has a lot more votes than you'd think. In the Senate, actually, there is a chance that there will be a vote on the single-payer bill. There is no chance that it will pass, but there may be a day scheduled for debate on single-payer, and the bill sponsored by Senators Paul Wellstone, Paul Simon, Howard Metzenbaum, Carol Mosley Braun, and Daniel Inouye in the Senate will come up. There is also, of course, a lively debate going on about whether states should have an unimpeded right to adopt single-payer health care systems and opt out of whatever the federal plan is, whether it be, as Cliff says, real health care reform or just insurance reform. As currently drafted, both the Mitchell bill and the Gephardt bill include an unimpeded right for states to go, or virtually unimpeded right for states to go to a single-payer health care system.
Okay, Sarah, let me just interrupt you for a second, because this is something that we do want to explore,
Right.
but I think we need to frame this a little bit for our viewers who may not be, I think, legitimately a little bit confused about
Right.
everything that's going on out there. Here in Maine, for instance, and I don't know how familiar you are with our situation in Maine, but our legislature has dealt with, over the last 2 sessions, an effort to try to get a single-payer system established on a statewide basis, and the upshot of it was a commission that has been created by the legislature to go off over the course of the next year and come back with 3 recommendations for 3 types of health care reform in the state, a multi-payer, a single-payer, and some sort of reform of the current system or something. So we in Maine are going to be facing a report which will provide some basis for the state of Maine going forward on its own. Is that, Cliff, did I get
Yeah,
that
I
pretty much
think
right?
that's correct. The big obstacle in the past, Sarah, just for your information and for viewers' information, is that people have hesitated to proceed, legislators, because they want the federal government to provide that opt-out for their own for the system that the state would want. And I think it would be useful for Sarah to elaborate on what that means, that the government would waive their options to allow these states to get out of what the federal government wants to do.
Could you just talk to that for a second, Sarah, about what is it that you would be looking for, the single-payer coalition would be looking for to emerge from the House and Senate and Conference Committee report that would enable states like Maine perhaps to go to a single-payer system?
Well, what we're really looking for is, one, the flexibility for the state to actually be able to adopt a different system if it thinks that that would be better than the federal system, and 2, that process be streamlined. Currently, under current law, if the state of Maine were to go to a single-payer system, or if any other state were, they could do so, but they would have to apply for a series of waivers from the federal government in order to get the money that is the federal money that's currently allocated for Medicare and Medicaid, and be able to use that money for their state single payer. And as the reality is that no state would be able to succeed in doing their single payer system unless they were able to redirect the federal funds and have everybody in one large pool together. So, one, we want a streamlined process. We appear to have won that battle in both houses. But there has been an attack recently on the right of states to go to single payer by multinational corporations who, I think, fearing the possibility of a real state single payer system being adopted in California, have stepped up the attack recently and got passed in a couple of committees in both houses an exemption that says that large employers over 5,000 that do business in more than one state can pull themselves out of a state single-payer system, and they can self-insure their employees rather than paying into that system. Mm-hmm. If that were to happen, if that were to be written into law, it would absolutely gut the right of states to go to a single-payer, and it would make it nearly impossible for a state to succeed. The state needs the money in the pool, and it needs those people. Just so you know, that would be about 25% of the employees in this country who would be pulled out of the pool. And it would also, in effect, it would transform the single payer or one payer of claims into a multiple payer, so that there would be, again, a complicated bureaucracy, although not as complicated as the current system. But when you went to the doctor, they still wouldn't know, well, are you insured by your employer, or are you insured by the state?
Right.
The good news is that we fought very hard in between the committee and the drafting of these bills to get them to draft them correctly, so that they now no longer, in both houses, the bills no longer include this exemption. The bad news is that the corporations are still fighting hard for this, mm-hmm. and are likely to put up amendments in both houses, if allowed, to put that exemption back in, and maybe even put other exemptions. They want to make sure, let's be clear about this, that they want to make sure that we fail when we finally get a state to go to single payer. And we want to make sure that we succeed, because if one state goes to single payer system and is successful, it will be a laboratory and an example for the whole rest of the nation. And that's especially true, of course, with a very populated, very media-focused state like right. California, that the rest of the country always watches.
Right. Well, we have talked a little bit here about California, and I don't think we had a chance to really say to our viewers that despite what everything is going on in Washington right now, there was an initiative referendum process underway in California, and a question will appear on the ballot in the November election that, and I don't know the wording of this, but as I understand it, if it was adopted by a majority of the voters in California, it would establish California to be the first state in the nation to go to strictly a single-payer health insurance system. Is that basically where we're at? Okay. Where you had some involvement and some participation with this thing, I wonder if you might speak a little bit to what you see shaping up in terms of the battle over this issue in the state of California.
Well, it's going to be an incredible fight in California. It looks like the organizing for our side is going very well so far, but also the opposition is getting organized. In order to qualify for the November ballot, folks out in California had to collect well over 1 million signatures in less than 100 days. And they did so with 60% of their organizers out there being volunteers, unpaid people. This is almost unheard of. Mm-hmm. And it's important for people to know, especially because I'm not sure whether the state of Maine has any kind of referendum process, but in an initiative rather than a referendum, it's binding. That means it becomes law. So if the folks out in California, a majority of them say yes, this would really establish a single-payer system. It would not just direct the legislature to do so. So it's an end run around the legislature and, to a certain extent, around the special interests. Mm-hmm. On our side, we've gotten a number of very big, very powerful endorsements. The California AARP, breaking with the national position, endorsed the single-payer initiative in California not too long ago. Also, the California branch of the NEA National Education Association endorsed the bill. So did the League of Women Voters. So did, in fact, the podiatrists, who we like to say voted with their feet. They're predominantly Republican group, so it was actually quite unusual to see. So did, as Cliff can tell you, I'm sure, some 10,000 doctors who are in the California Medical Association, and the California Medical Association, which is the branch of the American Medical Association in California, normally a very conservative oppositional force against any kind of real health care reform, is taking a path on this, is not opposing it.
That's a very interesting mix. I would expect that Harry and Louise may be showing up on the other side of this.
That's the scary part.
Yeah.
We have heard rumors, and I hope to God they're not true, that the insurance industry is prepared to spend as much as $100 million to defeat this initiative. Just to put that in perspective, I'm sure everyone knows that that's a huge amount of money, but that is about as much as Bill Clinton spent to get elected, and about as much has been spent to influence the health care reform debate total in Washington this year. So it would mean a massive, massive media blitz. And what the folks, the forces on the other side will be saying, of course, is this is socialized medicine, this is government-run, you don't want the government involved with your health care, this will be a bureaucracy that will take away your rights, and they're going to attack it really in all the ways that they've attacked the Clinton health care bill, only more so because it so directly gets at their bottom line and takes away their ability to sell health insurance in the state of California. We have all kinds of wonderful arguments to answer what they're saying, but we aren't going to have the kind of advertising money that they have. Although it does look like the fundraising is going very well, and the budget is for our side is going to be in the millions. And that's because a lot of big groups nationwide and in California have ponied up big money for this, seeing it as a real chance for meaningful health care reform, especially since Washington is kind of going down the tube.
Right. Well, Sarah, let me ask you in a couple minutes, I know you've got to run off to another interview with a competing network, but I wonder if you might, in the remaining couple minutes, just take advantage of this opportunity to get out what are the basic arguments to rebut the health insurance industry's arguments that they're going to be the scare tactics that you referred to, that this is government taking over your health and is going to be taking over your lives. What's the basic response that you have to that?
Well, the biggest thing is that the government is really predominantly involved in a single-payer system in the financing of health care, not in the running of it. This isn't a system where the doctors work for the government and the hospitals are owned by the government. That's the way they do it in some countries like Britain, but it isn't the way they do it in Canada, which is what we're basing a single-payer healthcare system on. I mean, I'm sure Cliff can get into much more detail on this, but the single-payer would allow the private sector health delivery system that we so enjoy, and it would allow all of us to have maximum choice to go to the doctor we want to, rather than being forced into HMOs and managed care facilities if we don't want. It would preserve managed care facilities if people chose to go to them, but if people voted with their feet and went elsewhere because they didn't want to stay in an HMO, then those would not survive. The reason that, though people have a lot of mistrust of government, the one thing that government can do very well is collect money and write checks, and Uncle Sam has been doing that for years. And it does it much more efficiently than the private health insurance industry. We know that publicly financed Medicare's overhead is just 3 cents on the dollar. In Canada, their administrative costs are less than a penny, but well over 20 cents of every dollar spent on private insurance premiums goes to overhead and administration. That's because there's all these different insurance companies competing with each other to provide the same health care to you, and that's very costly. And so I think once folks understand that the insurance industry's self-interest is what's destroying our current healthcare system, they can understand why they'd be so much better off under a government-financed plan. And it's not as frightening if you realize that your doctor will still be private, and so will the hospital. It's just they'll be reimbursed by a different entity.
Right. Well, Sarah, it sounds very simple here, and I think one of the problems, and I think probably Cliff and I are going to get into this in a minute, is that the message that you're bringing here isn't really getting out very effectively in the general media. We've not seen any real advertising campaign. In fact, you may know something about the fact that the Neighbor to Neighbor organization some year or so ago produced some television commercials about single payer that networks and television stations refused to run.
Yeah, I do know about that. They were saying it's time, the health insurance industry, it's time for it to go. And they couldn't get their ads run on a lot of stations, even though they had the money to buy the time. And that's, of course, because the health insurance industry spends millions and billions of dollars on advertising every year, and their business is much more valuable to those stations than it is to us. The Single Payer Across the Nation campaign, which PNHP is a big part of, and so is Public Citizen, and so is Neighbor to Neighbor, produced some wonderful television ads, which I hope you all have had a chance to see this year, spoofing the Harry and Louise ads and putting on the comedy team of Stiller and Mira. These were produced up in New York by the donated labor of a number of local labor unions up there. It was a really tremendous grassroots effort, and they donated nearly $250,000 of labor and materials to produce these high-quality commercials.
Well, that's great. We've not had the chance to see them here on commercial television in Maine, but I think we might be able to work those commercials into our show here on Public Access.
Oh, great.
What's wrong, honey?
I'm confused about Harry and Louise.
You mean that worried couple on the insurance company's commercials?
They're so confused about health care.
And you're confused because they're confused.
They keep saying there's got to be a better way.
There is. The single-payer system. Everyone is covered, you get full benefits, and you choose your own doctor.
Harry and Louise, there is a better way. Honey, who's our congressman?
Oh, you know, we voted for him for years.
Well, we got to get him to support single-payer national health care. It's the best system, the only one that works.
But he gets a lot of pressure from the insurance companies.
And votes from us.
What are you doing?
I'm getting his number. I'm telling him to support Wellstone McDermott Conyers single-payer bill.
That's a lot of words.
Well, then it's something he'll understand.
Okay. How can we solve the health care crisis?
Both Ralph Nader and the president of General Motors say that single payer is the answer.
And when those guys agree on anything, we should shout it from the rooftops.
Send up a flare.
How about a Roman candle?
Single payer.
The only plan that works.
And they have aired in Washington and New York and in approximately 10 other cities across the country, predominantly because local folks have raised the money to put them on. We haven't had a big media budget, but we have been able to get them placed. We also have a full-page ad that says, why aren't you hearing about the real solution, the great health reform hijack of 1994, and tells exactly why you haven't been hearing about single payer. And that ran as recently as Friday in a full page in the New York Times. So we're trying to get our message out there. We also have a beautiful ad that's in all the 25 metro stations in Washington, D.C. right now that just started last week, and it's quite controversial. It's creating a little bit of a stir down here, but you probably haven't heard about it up there.
Well, things do take a little time to get up here, but
That ad says, and you could put it on the air on your show, too, if you want to show it. It says, gee, Harry, I didn't know our congressman was an insurance agent. And then it says, Congress is about to decide who to take care of, insurance companies companies or the rest of us. Simple choice, don't you think? Single payer, the only real health care reform. Call Congress and remind them who they work for.
That's great. Subtle, it's not.
No, it's not intended to be subtle.
Yes, and it sounds great. I think we'll definitely look at getting some copies of those ads to run on our show.
Great.
Sara, I want to thank you for spending a few minutes with us, and appreciate your input to this thing. Cliff, do you have any last comments for Sara?
No, thank you. Very informative, Sara, and keep up the good work. Sounds like we've got a long ways to go.
Yeah, I suspect we'll have more to talk about with this, and we hope we'll be able to get you on again to talk about the progress of the California initiative process. So.
Okay, I'm happy to anytime, and keep up the good work up there.
Very good. Thank you very much.
Bye-bye.
Bye now. That was, for those of you who turned in late, that was a telephone hookup with Sara Nichols of Public Citizen in Washington, D.C., one of the organizations that is working very hard for a single-payer alternative to health care reform. Let's turn our attention, Cliff, to the state of Maine. You've been involved. I know we've known each other for a number of years now, and you've been working here in trying to move the issue in Maine. Tell us where you think we are in terms of our ability in Maine to get this
Well,
done.
I think it's interesting. I think the public support is there. I think it's been there for a long time, since the telephone strike back in '89. I think the public awareness, especially in the state of Maine, has been high. It continues to be high. I think legislators are beginning to listen more carefully to what consumers are saying. The big issue has been, what are the providers saying? And I am surprised, but echoing what Sara said, physicians are coming around in great numbers to the idea of single payer. They're scared to death of managed care. Managed care has not had a major impact yet in the state of Maine, but will soon. It's probably around 5 to 10% of the provision of medical care among consumers in Maine, but it will shortly be closer to 25 or 30%, and people are afraid of that, and providers are afraid of that, especially physicians who are beginning to say, I can't decide what I want to do with this patient because the insurance company is making me decide. Or I can only spend a certain amount of money because the company says I can only spend a certain amount of money. Or I can only prescribe this drug because that's all that's allowed to me. So there's a sudden rush among physicians, especially, as Sara said, some of the surgeons who are extremely enthusiastic about the idea of single pay and saying, we would rather deal with one single unit that appears to be fair, that has a precedent. Medicare is the major precedence for single pay in this country, and you don't hear any physicians complain about Medicare. You don't hear any providers saying we shouldn't have this. We're all of a sudden saying we would prefer Medicare in the very direct approach and the lack of paperwork to this idea of managed care.
You know, it's interesting you mentioned Medicare, because I think that in the debate that's going on in the public, although it's unfortunately been shifted from, you know, the big headline debate is about whether we're talking about employer mandate, soft triggers, in the year 2000, you know, for whole lots of reasons, the debate has been shifted that way, and I'd suggest that one of the major reasons for that has been the absolute intransigence of virtually every Republican member of the Congress to consider anything that approaches a requirement that universal health care coverage be provided to citizens of the United States. But nonetheless, the debate now doesn't deal with single payer, but Senator Mitchell, in defending his, shall we say, modest, you know, attempt at reform, is talking about Medicare and throwing back in the face of the Republicans who are opposing this the concept that these are the same people who are against Medicare.
Well, and I think that's true, and if, for people who don't know the bills, the Gephardt bill is really making Medicare Part C, which is an expansion of the Medicare pool from just the elderly and some disabled to include almost everybody who doesn't have health insurance, who's poor or near poor, who doesn't qualify for Medicaid, and eliminating Medicaid. So the chances are of having a single payer in the Gephardt bill for about 30 to 40% of the population, which really is a nice idea, but it should go the entire length. Because if we don't have one system, we have two competing systems, a private system and a public system, then the problems come in terms of access and how much availability physicians will provide to this sort of second-class system, which may eventually set up. And we know without guidelines to say, look, this is the system of care, that could potentially be a problem. So instead of going halfway, such as the Gephardt bill does, with an attempt to go full way, it would probably be better to just go the full length. The problem is, in the argument that everybody talks about, is government interference. And that's a scare tactic, as Sarah mentioned. It's not that the government's interfering with your choice or what you're doing or who's going to be on a dialysis machine or not. What the government is doing is simply paying the bills.
Right.
And in Canada, they can do that for 10% of the overhead versus 30% in this country. And they can do it with only 1 or 2 people in a physician's office using electronic billing, whereas now we take 10 or more people to do the complicated billing. So we can eliminate costs and provide the same level of care and not have the government interfere in any decision.
Of course, the thing that people worry about, and I'm sure viewers of this show worry about, is, well, gee, if we do that, that means taxes. And that's the, the dirty word, the T word. People don't want to talk about taxes. Premiums is one thing. They can deal with things if you call them premiums or co-payments, but they can't deal with things if you call them taxes. Perhaps you could help clarify for our viewers, how is it that they're paying for health care now, and how might that just be money redirected under a single-payer approach?
Well, they're paying for it in taxes. It's just taxes you're paying to the insurance company, and that money goes up much quicker. Those rates and premiums go up much greater than the federal tax system or the state tax system. In fact, they're not responsive to any regulation. So as many of you know, that if you raise your premiums because you get sick or because the cost of providing that care is greater, then you have to pay it. And when you're talking about $6,000 to $8,000 a year for a family, that's not nearly what we'd be paying in taxes. But as you said, the T word's out there, people are scared, they don't want to pay for it because they think it's taxes. But in fact, it's a premium, is a tax. We'd be doing it the same way, except this way it would be just a small portion of the total tax bill. That's very unacceptable to people because I think they rebel from the idea of this concept of taxes. But let me just enlighten the people out there a little bit about what happens when we talk about how are we paying. In fact, if somebody comes in and doesn't have health insurance, then what happens is that is paid for by the people who do have health insurance. It's what's called cost shifting, and what happens is your premiums go up as care is provided to people who don't have insurance. So every time your premium goes up, it's not always a reflection of that you've done something wrong or you've been in an auto accident like it happens in autos insurance, but rather is a function of the lack of health care insurance for those many 37 million people who don't have it. The cost has to be shifted because the providers have to capture the revenue somewhere. So if a hospital, for example, a medical center has 20% of their people don't have health insurance, then they have to capture that 20% of the income by raising their rates, which is then passed on to as premiums to Blue Cross or to other insurers.
Right.
So you're paying that hidden cost, which is clearly a hidden tax. It's a basic fundamental attitude in my talking to everybody is, and this is going to take a long time to change, but people are beginning to realize we all got to take care of each other. And if you can accept responsibility for taking care of everybody else, then you have accepted the idea of universal coverage. Anything short of that, or saying leave that person to fend for himself, is exactly what's happening in Congress now. We're going to insure a portion, we're going to leave the other portion to see what they do, we'll decide. Unless you can accept that concept, I think that's what we have to hammer home, is that we're all in this together, and it doesn't matter if you're poor or if you're rich. If you're rich and you're paying health insurance, you're going to be paying more because the poor don't have health insurance, and that cost is going to be passed on to you.
Right. See, I think it's really important to focus on essentially people's self-interest in this. That we're talking about people understanding the need to take care of each other, not out of some altruistic sense of brotherhood, but because it costs us indirectly a lot of money, because there are so many people who aren't covered and so many people who are working who are not covered. That's the other big myth there. I think many people still believe that most of the uninsured people out there are somehow on the dole, or not responsible citizens, et cetera, et cetera. If they only had a job, then they'd have health care.
That's right. And that obviously is not the case, and there's many, many, especially in the state of Maine, especially people who work cutting wood or in the tourism industry, who don't buy insurance primarily because they're working for themselves or for small groups, and they're just getting by, and they don't want to spend $6,000 a year to insure their family. It's purely an economic choice, but it isn't because they're unemployed. And you're exactly right, Mike. What we're talking about is we have to reduce the number of people that don't have insurance to nothing, because until we do that, every single cost of providing care for those people is going to be passed on to us. And what's bad about our system now is that if you don't have insurance, you don't get into the system. When you finally get into the system, poor and broke, you're also sick. That means your average cost of care is much greater. That means we're going to end up paying more for those same people because they've delayed entry into the system. So when we talk about access to system means immediate access and availability to the healthcare system. If we don't have it, then we're going to continue to pay the cost of those people who are staying out because they're afraid to go to the doctor.
Right. Now that's what you say. I mean, at your end, you're
Yeah.
chief of medicine at the at St. Joseph's Hospital in Bangor, which we mentioned at the outset of the program. But you see people, and your colleagues see people when they are presenting quite ill, and bills are running up that are then being passed on to the rest of us. Right?
That's correct. That's correct.
Now, for a lot of people looking at this show, you know, you've got health insurance. We negotiate. Our union negotiates for health benefits for our members. It's one of the most important benefit protections that people can have because it's a basic, you know, you need it to sustain life in this economy. And I've heard from many people who we represent who've said, you know, we've got our health benefits. You know, let's just protect our own health benefits and let's not mess around with this universal stuff. And businesses, of course, want to be competitive because they're in competition constantly for you know, business, for jobs. It's a rat race out there, and people look to this healthcare thing as a cost of doing business and one that puts them at a competitive disadvantage if they provide healthcare. How might you respond, or how might your organization, Physicians for National Health Program, respond to employers who would say that passing a single-payer plan in the state of, name it, California, Maine, whatever, will put our business that's operating here in this state at a competitive disadvantage, and we will lose jobs as a result?
Well, I would say two things. First, that it would actually probably provide an advantage, especially if other states do not have single payer. The fact is that you'd have guaranteed coverage for a worker is a major attraction for somebody being in this state. The fact is that you can never lose your coverage, as Bill Clinton's always fond of talking about. We want somebody who gets insurance and has it for the rest of their lives. That's a real attraction. That's an attraction for good quality workers. It's an attraction for business. The less negotiations they have to do and deal with this on an ongoing basis, the better off they are. In answer to the first part of your question, why should I give up what's good? The answer is the island is shrinking. You no longer can consider yourself just you in this country because, as we've talked about, those hidden costs are constantly being passed on to you. So just look at 5 years ago. Look at the difference in negotiations now for healthcare provision. Project out another 5 years. It's going to be increasingly harder for a company to negotiate full healthcare benefits in this void when those costs of taking care of all the other people in this country are factored in. So I would say the island is shrinking. You're less likely in the future to be able to protect your own basic coverage plan without some plan to insure everybody else.
Well, I think that you know, we are going to face more of that under whatever emerges or doesn't emerge from Washington. I mean, I think we have passed some time ago the point of thinking that the healthcare crisis is going to be solved by this Congress, and you know, I hope that they do no harm. I hope that whatever emerges moves us in the direction of this the universal solution that you're suggesting, and I frankly agree, and our union agrees, is the solution to this problem of establishing a single-payer system. But where might we be here in the state of Maine? Let's think, you know, beyond November, when the new legislature will convene and this healthcare reform commission is going to be looking at the three alternatives for Maine.
Well, let me project because I think we have a precedent. One of the reasons this legislation got through is that, number one, the legislators did not want to vote courageously for single pay because they were afraid that the federal government had not cleared the way. And secondly, because this was sort of a neutral option. Instead of adopting a total reform, let's form a commission to look at the three options: single pay, a private finance system that's similar to what we have now, and then some sort of managed care hybrid. The example we have is Vermont, and Vermont sort of, the three-member commission that was designed to do that sort of fell apart at the last minute because the governor got a little nervous about it, because the signals were not clear from the federal government, and because there was a tremendous publicity in the state of Vermont among industry saying, look, this is socialized medicine, how can we go to this, we have other options. How I would project the state of Maine going is that same process is going to happen. What we need to do is continue to educate people about where we are in terms of what is the best option. And single pay clearly is the lowest administrative cost. We're talking 5 to 10% versus 30 to 40%. We don't have to pay $3 million for a CEO of a private insurance company in this state. We don't have to pay the administrative costs for advertising for the lowest possible rate. We're going to pay for one single institution to collect the bills, but keeping intact a patient's choice. That is a goal that I think we can work with in terms of educating people, breaking down the barriers. This is a tax, this is the federal government, this is the state can't do anything right, how can it administer this system? We can break down those barriers, and I see that as being a major process in the next year and a half, because the committee is going to recommend 3 possible options. And I doubt with 3 distinct members that there's going to be unanimity. It's going to say, look, we're going to have single payer. It's up to the legislators to then look at those options and say, what is this? What is the simplest, easiest choice? And I think when we talk about labor and competition and keeping costs down in the state, that certainly if the federal government allows those waivers to go through, single pay will be the way to go. I don't project it as an easy fight, and I think this model of going to a commission prolongs the process. It does give us an opportunity to get our message out, but I think it's going to be a long, hard sell.
Yeah, I would think that, you know, in industries that I'm familiar with and shops that I know, healthcare costs are now, as a percentage of payroll, you know, approaching, you know, 17, 18% of payroll, which is, you know, a huge burden for the employer to be able to carry if that employer is competing with others who are taking the option that employers have of contributing nothing. I mean, they don't want employer mandates, which means they'd like the ability for employers to choose. They want employer choice, to choose to pay nothing for health insurance for people. So a single payer option, to the extent that it is focused on, you know, controlling the costs and evenly and fairly spreading out costs based on ability to pay, could be an economic development tool for the state of Maine.
Absolutely, and I think reinforcing that is that this is single pay represents a progressive way of financing the system. The more money you have, the more you're going to pay in. In the employer mandate system, everybody's going to pay in a fixed amount, whether you make $1 million or whether you make $20,000. And this system, where it's progressive based on your income, is really clearly a fair, more equitable way to go.
Well, Cliff, I think that maybe what would be very helpful for our viewers if we sort of concluded our show by looking at a videotape that's been produced by a group called Healthcare, it's called something, I'm sorry, it's called Healthcare We Need It, or something very much like that. Healthcare We Gotta Have It.
Right.
Remote control, I gotta have it in order to turn this on. So, the wrong one. Could you, Cliff, would you mind doing the honors here? Folks, this is, you're seeing it all here today, from live hookups to, we forgot the VCR. But we're gonna be going out here probably with looking at a videotape of Healthcare We Gotta Have It. We'll see if we have time. We'll be back and have an opportunity to comment a little bit about the videotape that we're taking a look at now.
Today, people are doing anything and everything to get health care, from staying in unwanted jobs or going jobless and impoverishing themselves to sustain their coverage. Even though health care is a basic need like food and water, in this country it has become a commodity that many of us cannot afford but are dying to get.
People who cannot afford insurance or who cannot get insurance are forced to get their health care from emergency rooms. What's wrong with that is that they're getting very expensive care and they're not getting the care they need. They're not getting care that will help them stay well. They're getting care when it's already too late.
The American economy will never rebound unless we get our health care price tag under control. The simple reason many corporations are practicing in other parts of the world and other borders is because of health care costs.
Every other industrialized country except South Africa has national health care. And so what it does is it puts us at a disadvantage. The corporations in the United States, even the car companies, Chrysler starting as the first one, began to complain that they were at a competitive disadvantage because they were spending more money for health care than they were spending for steel.
Although we spend so much more money than most other industrialized nations for care, we're not in better health. Out of 24 industrialized nations, the U.S. ranks 21st in infant mortality and 17th in life expectancy.
What that means is that in this country of plenty with many healthcare resources, babies are dying unnecessarily. We have enough money in the U.S. healthcare system now to give everyone, including the uninsured and the underinsured, everyone the care that they need when we need it. We have it in the system now.
Currently, we're spending 20% of our healthcare dollar, every healthcare dollar, on insurance companies, the billing and administrative costs, nothing having to do with care.
If you go with a broken leg to a hospital and you need to have an X-ray and somebody set your broken leg, you have unleashed a mound of paperwork that the average person does not know about.
Marv, I got a feeling that we're going to make a killing today.
Oh, yeah? Where's your machine gun?
The main thing about money, Bud, makes you do things you don't want to do.
Paid in full.
Miss Smith, I'm looking at your form now, and I can see that they were filled out incorrectly. Ma'am, we are unable to help you. I'm sorry. You failed to fill out Form H212 to authorize tests, and you did not correctly complete Form B35.
Paid in full. Paid in full.
Insurance is a business. They want the people they want you to pay your premium, but just don't get sick. Meaning keep giving them money, but they don't want to give any of it back to you.
So they skim off those people in our society that are the healthiest and cost them the least. Then they deny those people that need services the most, that have expensive conditions like cancer, HIV, and diabetes.
And who pays for this? We pay for it. We pay for it out of our pockets, and we pay for it out of our hides. We pay for it out of our taxes. Because who the insurance companies don't take care of, who they deny, ultimately are dependent on the government, on the state, and we wind up paying for that out of our taxes.
Americans pay for care in a variety of ways, through private insurance premiums, co-payments and deductibles, through out-of-pocket costs for services like long-term care, which insurance policies do not cover, through workers' compensation and auto insurance, through wages lost in exchange for on-the-job coverage, and through taxes used to pay for Medicare, Medicaid, and other health care programs. These payments hold together a fraying patchwork of public and private insurance companies that leave millions of people uninsured and even millions more dangerously underinsured.
The multi-payer system is not a system at all. It's a disorganized free market free-for-all where consumers are paying multiple times for services they may not even be receiving.
The healthcare system, well, it sucks.
Many of our politicians are leaning towards an untried healthcare reform proposal known as managed competition. This chart, prepared by the Office of Management and Budget, explains how managed competition would work.
Managed competition is a theory that has never been practiced anywhere on the face of the earth. It's something that a group of rich, white CEOs, major executives of your insurance companies have come together and decided that this is a way that they can compromise and still not lose their millions of dollars.
Managed competition would not only leave the insurance companies and their current system of administrative waste intact, it would actually add another layer of bureaucracy to this system, increasing costs. Under managed competition, purchasing co-ops would be created to buy your health care from insurance companies. These new purchasing co-ops, whether they be your employer or the federal government, would save money for the country by offering bare-bones minimum benefits plans. Financial deterrents, such as very high premiums and deductibles, would squeeze the consumer to do without and block all but the wealthiest from receiving comprehensive coverage.
Instead of saving money by trimming bureaucracies, the various proposals plan on saving money by limiting care, treatment, and freedoms like doctor choice. They would push all but the very wealthy into tightly controlled managed plans. Bureaucrats would decide what kind of care you could get, how much, from whom, and when.
Managed competition will still give you this rationing of health care. Some people will get better, some people will get worse, and that will depend on A, whatever race you are, B, where you live, C, your income, your age, whether or not you need long-term care, whether or not you're HIV positive. All of these factors will still exist.
Single payer is a universal, comprehensive national health plan currently being used in Canada and in various forms around the world. Single payer eliminates the insurance company middleman. The money we're already wasting on insurance company bureaucracy and profits is redirected into a national healthcare fund that would cover everyone under the same comprehensive, high-quality plan. The fund, administered by the government like Social Security, is financed through a progressive tax. A progressive tax means people would pay according to their means, not their health status. Under single payer, not only would nearly every American, 80% of us, be paying less for care, we would be covered for more.
Single payer is not spending more money. Single payer is just redirecting funds that are already spent on bureaucracy, paperwork, and administrative costs.
Even the General Accounting Office has said that if we had a single-payer type of system like Canada's in this country, we would save about 10% on our health care bill. That's enough money to put back into the system to provide health care for all of the uninsured and underinsured people in this country.
Our parents and grandparents struggled. They got Social Security, but they didn't get health care, even though they attempted to. Then in the 60s, they tried again. They got Medicare and Medicaid, but still millions and millions of people were left out. And so now it's our turn.
Welcome back to the concluding minutes of this edition of Cavanaugh's Corner. I'm with Dr. Cliff Rosen from Physicians for National Health Program, and we just looked at a video, Healthcare We Gotta Have It, about the single payer plan. Cliff, we're going to have, there will be a future after the congressional reform debate concludes in whatever way it does. What do you see happening in Maine?
Well, I see that Maine, actually, the debate's going to start up, and we're actually going to be in a very proactive stance where there will be some minimal change probably at the federal level, but a chance for the states to really go after certain initiatives, especially if the waivers are kept intact, especially if the California initiative goes through. What I see is aggressive debate and education about the prospects of single pay and about the potential benefits of reducing administrative costs. One thing that has not been talked about in this debate is cost containment, and we have to go back to that major issue. All the surveys, the consumers are for single payer, a lot of the providers are moving over to single payer. It makes sense, but it makes the most sense economically. We've got to reduce administrative overhead, and we can't do it by many private insurance companies with advertising, with administrative costs due to multiple forms. We have to go to a system that is easiestly the simplest and also that guarantees universal coverage.
I think that we ought to be looking here in Maine at, who are the opponents of reform. We certainly don't feel like Senator Mitchell's bill goes far enough for us, but even with that very limited reform, there's some major opposition that's been organized by the insurance lobby and their allies, Republicans right down the line, apparently are lining up, at least as of today. And I think, you know, we need to be aware of those forces that are allied against what really the majority of citizens in the state need. And we believe, you're here to tell us from your perspective, we believe we could achieve with
That's correct, and I think we have to break down the barrier that somehow the government running this system is not going to be good for people. Because in fact, Medicare has been a godsend for people. And with a 3% administrative overhead, you can't get better efficiency than you can get in Medicare. And I challenge those people, the Republicans, the legislators who say, we don't want government to interfere. I challenge them to say that they don't want the government to take care of them when they become 65. Because every single one of them embraces Medicare. Not a single person would get up and say, we shouldn't have the Medicare system. So what's wrong with having a government-run system that takes care of everybody? That's the single most important element that is a fallacy that we have to break down in our discussions.
You know, very interestingly, virtually those same words were said by Senator Mitchell when he was on McNeil-Lehrer the night that he was introducing his bill, challenging the Republicans to say any one of them would be opposed to Medicare. None of them are moving for repeal of the Medicare system or repeal of the employer mandate of Social Security. These are advances that we've struggled through here over many years. And what Cliff Rosen is saying and what our union has been saying is that there has to be a better, we have to make progress in this society, and this is the major hurdle, major social objective that we have right now, is to rationalize the healthcare delivery system, the insurance system that is choking so many people and leaving so many out in the cold. So we will be, I'm sure, in the months to come, talking more about the effort here in Maine. We'll be looking to what happens in California with the referendum and the initiative on single payer. And Cliff Rosen, I want to thank you very much for coming and joining me this afternoon. And thank our viewers for tuning in to another edition of Cavanaugh's Corner. And we'll be back to look at health care reform after the congressional debate. Thanks again.
Listen, why don't we get rid of the health insurance companies? Let's go to the blackboard. Here's what we spend on health care. It's a lot. But if we get rid of health insurance companies, we can have complete coverage for everyone for the same money. But any plan that keeps these guys in business will cost billions more in taxes, taxes, taxes. To me, it's a no-brainer.
It's time for them to go. Call Congress today.